Sorry. My God, I'm blown away because it just conveys everything that we want to convey. We do have quite a few questions, but right now I'm going to call upon Anjali for Marathi, Anusha for Telugu, Anita for Malayalam, and Nabanita for Bengali, as well as Puneet for Hindi. We're going to break into various breakout rooms for 10 minutes while these volunteers, wonderful that it's just fantastic that they're here, are just going to summarize what has happened over the last 40 minutes or so for participants who would feel more comfortable understanding in their native language. So it is right now 7:08 on my watch, and we'll come back together at about 7:20 just to take question answers for the remaining time. So thank you all, and if Puneet, you can activate the breakout rooms for those who want them, and we'll come back together, regroup at 7:20.
Yeah, and those participants who do not see option for breakout rooms, that's because you did not opt for it. But in case if you want to opt for any of these languages, please put it in the chat, and Nicole will assign you to the breakout room.
And Sushma, I was just thinking for the rest of the people, they can stay logged in, don't log out, just stay logged in until everybody returns to the main room.
Yes, 7:20. Thank you. So thank you, everybody. And I welcome, we all welcome questions in the chat box. And if you want to, ask them through the interpreter or the translators, then maybe they can, I guess, put up their hands. Puneet, if you could just monitor that. I'm going to start with a very basic question, and I'm not sure which or who of our three experts to address this to. But, as parents, many of us hear the term evidence-based practices or treatments. What does the term evidence-based really mean for those of us who are kind of hunting, if you will? If somebody could just explain that, one of you.
Vrajesh, will you take that?
Essentially, the problem with old therapies in medicine was based on experience. So you had doctors try different things, and over time things were found to be useful. And of course, it was not that many of these practices were wrong, or many of the results of these practices were wrong. In fact, there were lots of medications which have been found either by serendipity, in the sense we tried something that worked, without any obvious reasons, and just experience has shown that, or because people used and everybody started using, but they were never subjected to any rigorous investigations, in the sense, were they really working, or was it other factors which made it better? So that was the old experience. And as my old professor used to say, experiences can be good and experiences can be bad. And once you have an experience, very often that colors your thinking about the future. So I think maybe in the 80s and 90s, I think evidence-based medicine started, and I think it started in the UK. So everything was subjected to scrutiny. What was thought to be fact was, you wanted to find good evidence for it. So, for example, I'll give you an example. There's a condition called tuberculosis, which causes sometimes brain meningitis, and there was never any evidence to show that it definitely steroids seem whether they help this condition or not. Something which all of us as students would be always use steroids. It was something which was taught to us and which we saw good results. So it was basically subjected to this controlled studies in South Africa, and it was proven to be correct. The steroids seem to help. Clearly, they seem to help. And then, so it became evidence. So experience was actually something which turned into evidence-based medicine. And there are certain, for example, certain surgeries. I'm just bringing up whatever comes to my mind. There are certain surgeries which help in stroke, which in the 80s and 90s, it was obvious that you had a block in your brain arteries and you bypass the block. Exactly like what happens in heart disease. You get a block and you bypass the block. And it was being used routinely. So anybody who had a brain artery block inside the brain, not in the neck, would be subject to this surgery. And then large studies were done, and they found that it just didn't make any difference whether you did this or you didn't do this. And don't always, you may not find an explanation, because medicine is an art. It's a science, yes, but the diseases behave differently in different people, and therefore this particular surgery was found to be useless. So the evidence did exactly opposite, was exactly opposite of what was thought to be. And so now we don't use that surgery anymore. And this has now become the mantra in the West. I mean, nobody will accept any publication which is based on experience, which are based on case reports, so single cases, what your experience has been. It has to be studied appropriately.
Dr. Hegde, do you want to add on to that?
Well, it's basically, as he very nicely puts, that it is the research which gets translated into everyday practice. And if in the research study it shows that it is effective, it becomes evidence-based. So we cannot talk on one man's experience and two people's experience, or this mother said this worked and that mother said it didn't work. We have to do it over a large number of people with variations in their phenotype or in the way they present. And we have to show that it works before we can promote it to other people as a treatment or a cure.
So what should parents do to make informed decisions about evidence-based treatments? And I'm going to direct that question to Dr. Hegde. Is there something else a parent should be doing?
I think a parent is so overwhelmed when this thing happens that you tend to grasp at whichever straw is most low-hanging and most easily accessible. And as they said, when you see it in publicized and you see it on TV and you hear it on radio and everyone is saying, why don't you try this or try that? It becomes like just, why not give it a shot? But I think whenever you try something, you have a physician who you trust. You have a doctor who has given you a diagnosis. Make the effort to take your set of questions, your concerns, discuss it with someone who can give you a right idea as to what is right or what is wrong. At the end of the day, the decision lies with the parent. Totally agree. And if a parent strongly believes in something, yes, he will go ahead and try it, not a concern. And I actually believe that sometimes parents should try one or two different things because they need an internal comfort to know they've given it everything they could before they've come to terms with it. But when you try something, it should never be at the cost of the child. It should never be at the cost of an uncertain outcome. There should be some comfort on security, safety, and then comes the efficacy. It should be safe, come what matter, then comes how effective it is on you. And then, what is it taking out of you? Like you mentioned, the cost of these treatments is astronomical. It puts poor parents in debt. They've sold homes. I mean, you have people who go out into the villages and hold programs to say, come and do stem cells, 70 lakhs. It's unbelievable. Now, where is a poor person going to get that? And to maximize on people who don't have the ability to understand and are not educated enough to do it, I think is, in my eyes, is criminal.
Can I add to that?
Of course.
If you have time. So there's one thing, I think what happens when you get a diagnosis is that acceptance of the diagnosis takes a very long time. And I think that unfortunately all physicians should make them aware that there are groups of parents, of professionals who are also have the same problem, and their experience in the sense, where they've learned about the disease. There are certain websites which are very good, even in different languages, and where if you have a certain basic education, you can basically learn about the disease. So education of the parent in conditions like autism is the first thing, I think, which makes you then look at treatments in a little more objectively. Otherwise, it's always this one said so, this one said so, this one said so, and that never really works.
Uma, when we were doing a research a little while ago, you had sort of come up with this astronomical, in some ways, number of 118 clinics that seem to be out there. Are there no ethical sort of guidelines that govern? And this may not be something you can answer, but I'm just curious. I mean, people are promoting these clinics, and these are doctors who are promoting these. We know of one near Bombay that's very well equipped, looks like a 5-star hotel. But again, is there nothing, what is the ethics? I mean, I don't even know how to ask this question, but there must be something that doctors are sort of forbidden from doing.
Okay, so the ICMR guidelines are recommendations, right? It's not legislation. So they are not yet laws. And there is a kind of a loophole where the use of stem cells from the individual's own body is used. Okay, so that's that comes under least regulation. And further, there is this so-called people are trying, some of the people who are doing this therapy are trying to say that minimally manipulated stem cells, minimally manipulated meaning where you don't have complicated procedures used, in the sense they don't use enzymes on the cell. So, that's the technical part. So they say that these are minimally manipulated stem cells and they don't require very strict regulation. Okay, so they are trying to push whatever they can, but the International Society for Stem Cell Research has clearly indicated that when you use stem cells from one region to try to make cells and sort out something in another organ, this requires stringent regulation. Okay, so it cannot escape regulation. So well, so much more work is required to for the government bodies to act on these recommendations that are there. So that's where we got to aim.
So before we go to Anna Balasubramaniam, there is a question in the chat. So are there any genuine websites which give correct guidance or information?
I recommend autismspeaks.org. Now, this is a American website. It's run by professionals and parents. It has information for parents, and not only on the syndrome of autism, so it tells you when to recognize it and all those kind of things and what to expect and stuff, but also on the what is the different therapies, what seems to be the best therapies, what are the biomedical or the different or the alternative therapies which have been used, and where these therapies stand. And this is updated regularly in 2022. So you have an idea and you can read about it and decide for yourself whether you want to give the alternative therapies, along with the other therapies, behavior therapies, etc., which you have to give.
So it's Autism Speaks, based out of the United States.
.org.
Autismspeaks.org. And that answers Vani Venu's question as well. Is there any website that throws light about the genuineness? And Dr. Udani recommends autismspeaks.org. Vani Balasubramaniam, I don't know where. Yeah, if you want to ask your question, go ahead, please.
Hello, my name is Anand.
Yes. Oh, I'm sorry, Anand.
Hi. No, I mean, I don't know how the registration came across as Anna, but it's actually Anand. So my question is, would be, I'll try and keep it possible, but there was a point that was raised about how the minimally manipulated stem cells do not have stringent regulations, if I'm interpreting it correctly. When I heard that, it raised a very important paradox in my mind, because I'll try and not get too technical, but I wanted to just know how a minimally manipulated, this would like this by nature itself does not guarantee any efficacy of the treatment, because how a minimally manipulated stem cell, when say like when say injected into an adult who essentially has had a developmental ambience which is more or less set, how can the external signals from the developmental ambience can actually reprogram a minimally manipulated stem cells to actually bridge the gap, as they call it. So that is my question. So how can it's a little surprising that molecular biologists haven't commented. I don't know how many molecular biologists have commented on this particular aspect, because the very nature of this project seems to be bleak. Sorry for the word, but that's how I like to phrase my question. I hope I was clear. Thank you.
Uma, you want to answer that?
Sure. So if I get it correctly, so the question is that, if I understood it correctly, that stem cells minimally manipulated or whatever. So if you put them in a dish and you give certain factors that can influence them to change to a different type of to produce different types of cells, is known. Okay, that does happen, but whether that can happen in the human, we don't know. In fact,
exactly.
No, so that is the question mark that I had even placed in my presentation. That you can trace cells in animals, but in humans we don't know anything. Does it go to the brain at all? Do they?
Exactly.
This is a real big question mark.
So to answer this, is like the cell is like the stem cell is, when it reaches the tissue level, it's not a totipotent cell at all. I would say that at an adult stage, it is doubtful whether it is even multipotent, right? So how can these therapies be marketed, even given that, like, the very nature of it is like shaky? I completely agree with you. Is what I'd like to say. Which is, given that these such claims are being allowed to flourish, where the basic tenets of these therapies are questionable, is actually surprising, to say the least.
Thanks, Anand. Yeah, I think Dr.
Hegde. Could you? Sorry, go ahead.
No, what I wanted to highlight, and you very rightly pointed out, Anand, is forget autism. Look at the other conditions they treat. They treat conditions which have genetic disorders like Duchenne's muscular dystrophy. You take the stem cell of a child of Duchenne's muscular dystrophy who has a gene defect in it, known gene defect, and you put that stem cell back into his body 2 hours later, and you claim this is going to cure your child. Now, you're putting a defective stem cell back into the child who already has that defective gene, and you're trying to convince the parent that that is a cure. Isn't that fraud?
Fraud, exactly.
Isn't that fraud?
It is.
It's one thing when you have no cure and you're giving hope, but when you know the causes and you're saying, I'm giving you a cure, with the same defective gene. I don't know. The problem is poor parents, I think, can't think straight when they go to such places. They just
a little thing over. Yeah, sorry. There's, I mean, Uma, can you explain about iPSCs? Because adult stem cells, which can be induced to become pluripotent, I think that's from another individual, can be used. And I think that nobody, I think what the stem cell guys in India are doing are completely fraudulent. But in the actual work, can you explain about induced pluripotent stem cells?
Right. So the induced pluripotent. Okay, we are going into
Can I just interrupt and say, please put it in layman's language?
No. Okay. So the name for this is called IPS, or induced pluripotent stem cell. Okay, it's when you take, say, easily available any kind of cell from your body. Okay, and maybe it's what is easy to pick up, like a skin cell or something from, like a cell from the mouth. Okay, so now, as I explained, these are specialized cells, right? And specialized cells cannot divide and cannot generally go back to being a stem cell. But they have found out since some years ago, and for the Japanese scientists, Yamanaka, and they found out this very amazing set of genes. There are just 3 or 4 genes that actually, when you put into an adult, mature, specialized cell, can make it go back to forming a stem cell. Okay, so you have this stem cell now from your own body, and it can form a lot of other kinds of it's basically like an embryonic stem cell, in the sense that it can form a lot of other types of specialized cells. At the moment, so they are still doing research that you can form organs with it, organoids, all these things, and using urine. So that is the induced pluripotent stem cell, still in research stage, but has a tremendous amount of potential.
Thank you for that. There's a question here, Dr. Udani. What we've spoken with regards to autism is, does it apply for refractory epilepsy like LGS?
Well, yes, autism is a disorder. It's not a disease. And like I said, there are several conditions which can lead to autism. One of them, which is fairly common in India, is bad epilepsy. Now, LGS is a type of bad epilepsy when the child falls, hurts himself. He may have been, he may have been a little slow, but maybe normal also. And then later on, because of the epilepsies, these things get worse and the behavior becomes autistic. You have autistic syndrome, autistic disorder coming up. So that's why, yes, but so you treat the epilepsy early enough, you might be able to reverse many of those symptoms.
Thank you. Mr. Govind, sorry, I'm going to butcher your name, but please.
Govind Parsar, yeah. Thank you. Yeah, hi. Basically, my question is with respect to the altered brain connectivity. Okay, so I think there is a PET scan, okay, which is typically like advised when these therapies are these stem cell therapies are conducted. So my question would be like with the PET scan, okay, so when there is these therapies or the stem cell therapies are conducted, so it is claimed that okay, you will see the change in the pattern, okay, in the result of the PET scan, okay. So my question is like, if that is true, is it have any kind of significance that okay, this will make a difference, okay, with the therapy?
You want me to answer? Yeah, see, the PET scan is actually something which shows us the metabolism, but how much energy the different cells in different parts of the brain are using at a point of time when the PET scan is done.
Mm-hmm.
And that does not really show us the, connectivity. There are other imaging techniques which do that. I don't want to go into the technical part of it. So what the stem cell guys do is they do the PET scan.
Mm-hmm.
What happens in the PET scan in children with autism at different times in their life is not yet very clear. And nobody has been able to use the PET scan as a marker to show improvement. You understand? So that's, I mean, so what they're using is actually not yet been considered evidence that the PET scan would change and then you're supposed to be better. So I think that it's a fallacious thing. You should not do that at all.
Miss Indu Natesan, sorry.
Hi. I just wanted to know, along with stem cell therapy, there's also this, they're also doing a detox regime with that. What is your opinion on a detox on its own? Is it beneficial to children with ASD?
When you say detox, what is it? Are they chelating? What are they doing?
Yeah, it is an IV. It's some kind of IV detox.
Chelators.
Chelators. Now we highlighted that these are all, I mean, they're not just not proved, they are actually with a whole set of side effects that you can get over a period of time. So it's totally not recommended to use any of these chelating or detox medications. If the detox is just nutritional, like you do a detox that you and I do, juices and vegetables and etc., that's a different issue whatsoever. But if you're giving a chemical and you're saying that's a detox that's a detox therapy, it's a no-no. Even as far as the PET or the SPECT scan, as Vrajesh put, we don't know what the normal picture for a child with autism is. We don't know what a normal picture for a child is because it varies from time to time and minute to minute of the day. So what they tell you is, see, this blue has become red and this red has become blue. See, my treatment has worked.
And you can even adjust the colors on the screen. So
absolutely. On the computer, I can change the color if I want to. So I don't even know what should be blue at what time of the day and what should be red at what time of the day. And with children with autism, the mood fluctuations are so much, the energy levels are so variable. You just get a different picture every time you do it. And he just convinces you that this is now treated. And do not forget, in a PET scan, you're doing a nuclear medicine scan. So you are putting a dye into the child, which ideally is not needed. You get it? So again, you don't just forget the fact that it costs 20,000 or 15,000 and you make a poor person do it twice, once before and once after. You're putting something to a child which is going to give you no result at the end of the day. And they're trying to hoodwink you into thinking he's done something fantastic.
Right.
Related to this question, there's another question in the chat which says a mainstream hospital regularly orders tests for heavy metal poisoning. And this is, any thoughts on this? Is it regularly tested for getting a diagnosis of autism? No.
So there are some institutes and doctors who do it. And this happens everywhere. Otherwise, we wouldn't be having this discussion because even the ones who are doing the stem cells are doctors only at the end of the day. But yes, I know there are some. And they go to Kasturba Hospital where they do the screen on heavy metals. And then whatever the result comes always looks a little off on something or the other. And then you're given a chelating agent to sort of wash it out. Strongly recommend, not needed, not recommended, and should not be pursued.
Okay, there are a couple of questions on acupuncture, homeopathy, Ayurveda as alternatives, treatments. Thoughts? Any thoughts on any of these?
Vrajesh?
See, the problem is in a country where there are so many multiple systems of medicine, some allopathy, which is the English, so-called English or Western form of medicine, runs on evidence and is tightly and very severely regulated by the Drug Controller of India and everything else. And the other systems of medicine, because they are old and they are part of Indian culture, and I'm nothing against them, but I'm just saying they are not studied as rigorously. They're not regulated as rigorously. And in fact, now you even have a law being passed in India to allow other system doctors to even practice what we are trained to do. So, I mean, so obviously, in my opinion, I don't know anything about what I know that sometimes Ayurveda helps patients, no doubt about that. Otherwise, it wouldn't have remained for so many years. But the question is, you know, Ayurveda does have heavy metals. Many times you use arsenic, many times you use gold in Ayurvedic preparations. And homeopathy, you know, I mean, these are all things very difficult to, I don't know much about them, so I really can't answer whether they help or not, but they're not tightly regulated, that's one thing. And they're not as well studied as the allopathic system of medicine.
Thank you for that. There's this one question that says, if one child has autism, what's the probability or possibility that the second child will have autism? So I think Dr. Udani, you had mentioned something about some genetic components. Maybe you can elaborate. One sec, I'll just finish the question. A renowned doctor mentioned that we can use a genetic test. Even I know that's untrue, but if you can elaborate on that there's a test, this person writes as a test that can check the genes and test the genes of the autistic child versus the unborn child. Is this
what are genes actually? They basically do, they can either cause, a single gene can cause a disease, or there may be multiple genes acting in concert or along with the environmental changes or whatever to trigger of a disease. So those are the two ways or many ways of causing disease. For example, let's give you an example of something which causes, say, Duchenne muscular dystrophy. With muscular dystrophy, all of you know, and that's caused by a single gene with a problem in it. Or let's now look at, say, asthma, or let's look at diabetes. These are also, there's a genetic influence which you may get from your father or mother, or heart disease, or for cancer. There are genes which are, but you know, if you have a cancer gene, but if you say you don't smoke, you may not get, you may not get lung cancer at all. But if you smoke a lot and you have the gene, maybe you do. So genes are therefore ubiquitous, and it's not, so what happens in autism, they found certain genes which are high risk genes. So if these are present in you, in your son or in your daughter, then there's a higher risk for autism. And then there are medium risk and then lower risk. Each of those risks.
I'd request Nivedita, please mute yourself. Puneet, can we do that? Thank you. Sorry, Dr.
So basically, they're different risk genes. So if you have one particular gene, your child is a higher risk. So if you have, say, an autism kid, now you do the genes, and obviously the most high risk genes are done. And if one or two come positive on that, then the chances are there that that particular gene is responsible, at least partly responsible for your condition. And then if you have get pregnant again, then you can get that thing tested during pregnancy at about 10 to 12 weeks. And you can find out if your fetus has the same gene. And if he does, then you have the information that yes, he has the gene. He may develop autism. Of course, it's not guaranteed, but though the high risk is there, if it's a high risk gene, you'll probably say that it's better to decide whether you want to medically terminate. And if it's a low risk gene, then you have to tell them that do not allow, you know, environmental triggers. So interaction should be more, your screen should be less, your, you know, all those kinds of things. I hope that explains it.
I think so. And there's another question about a parent asking, I mean, noting here that that they, sorry, genetic test. Parents I spoke to did stem cell and for their autistic children gave positive feedback. But I think that has already been covered because most people who promote the stem cell or do the actual treatment also give a lot of other therapies. So it's very hard to weed out what actually worked. I think everyone has mentioned that. So there's another question. Can you please help me to understand if your team is, research about using stem cells for CP, or is it only for autism? So there's no research that we know of currently, right, for CP?
Oh, there is research. There is research on cerebral palsy, not in India. It's happening abroad in stem cell centers. Most of the research in stem cells so far has been either phase 1 or phase 2, that is to look for the safety. Then it is done in animal models. And it is only recently that studies have started out on humans with the stem cells. So there are numerous ongoing studies happening just now in the West, because you need a lot of finance and a lot of resources to do a very ethical stem cell study. The quality of the cell is very important. It has to come from a recognized accredited lab. Only then those stems can be used. And we are hoping that in the next 5 to 10 years, we will get results as to what works, not just what works, when should it be given in the disease process, what is the dose that should be given, where should it be given, how should it be given, what is the quantity of cells that need to be given. So you can see the number of variations which are there. So to get that correct fix or that correct combination that makes the most scientific sense is going to take time.
And a similar question about seizures and the research as far as seizures, children who have seizures and stem cell therapy. So would that also be a similar kind of response in terms of the research is ongoing as far as that goes too?
So that's a very...
Yeah, go on. Well,
it's a very heterogeneous disease. It's very, seizures can be very benign, some are very severe. So you can talk about stem cells in a particular condition which causes seizures, yes, but that I'm not aware of any stem cell research in seizures.
We're almost out of time here. I'd like each of you, if you would, just make one last comment that you want to really, for our audience here, to take home from your perspective, what that might be. And before that, I'm just going to answer. There's a question here about if anyone's taking any action against unethical practices. I think from the perspective of ASK and all of us here, we are doing our best to promote good science-based practices in everything. So this is our endeavor, knowing how much parents suffer when they actually opt for this stem cell therapy and all other practices like that. It's our endeavor to give parents information so that they can make the best informed choices. So please consider it that, or this whole webinar will be posted. The recording will be posted for you to go back and listen to. But if I may request, Uma, one parting statement, and then Dr. Udani, and then Dr. Hegde, please, if you will.
I would say in general, just beware, tread carefully before going in for something as invasive as stem cell therapy. Really think twice.
Thank you. Dr. Udani, one last comment.
I think my thing is, when you have these unfortunate developmental disorders in your kids, I think educate yourself as much as possible before you undertake any sort of therapy, whether proven or unproven. And just think that it is not that every therapy we use has to be evidence-based, but the point is that at the present time, clearly stem cell is in the field of research, investigations, and hopefully it will give some better results in the future, but at present, definitely don't do it. And please beware of charlatans all over the place.
Okay. Dr. Hegde?
So mine would just be a little similar, that in your anxiety and your concern for your child, step back a little, think, try to understand what you are embarking into, and ask. There will always be someone there to guide you and help you with the correct advice. Ask what it is, try to understand what you are giving or doing for your child, and then make your decision. And if you still believe it's the best for your child, it's yours to decide.
Thank you so much for that. Thank you, Dr. Ladiwala, Uma, Dr. Udani, and Dr. Hegde. Can't thank you enough from all of us at ASK for taking your time to listen to concerned parents and everyone's questions. Thank you, participants, audience. If there's anything else that we can do, ASK is here. And as our tagline says, all you have to do is ask. And lastly, I want to thank all our wonderful translators, Anjali, Anusha, Anita, Nabanita, and Puneet, again, for helping us take these important messages out in a concerted way. Thank you again. Good night.
Thank you.
Thank you.
Good night. Thank you.
Good night.